What is your name?
Hemant Banare,
Coming from?
Panji.
Panji.
Yeah.
What you are doing?
I'm having a business.
Uh-huh. Just tell me what is your problem and how you came to our center.
See, somewhere in end of 2000, end of I think 99, uh, I was playing cricket when a tennis ball hit on my testis. I was betting, the tennis ball hit on my testis. Now, when it hit me, I had a lot of problem. I had a lot of pains, severe pains. At that time, what I did was just threw everything away, and then I slept totally on the ground for maybe 10-15 minutes. Then I got up, and then I was feeling some relief on the pain. But then after that, maybe 5-6 days after that or 10 days after that, the pain started coming up again and again. So I had no clue ki what had happened, but the pain was there, and the pain had grown severe as the days passed by. So what I did was I went to the doctors. They advised me some gel to be put, some cream to be put, some medicines they gave, but basically all these things were the painkillers, not more than that. Now I still started taking all those medicines, but then the pain didn't go off. Now it happened so okay, after some 2-3 months I saw that there is no effect. The painkillers only took some temporary pain out of my body, but then the pain still existed. So what I did was, I had heard once about Dr. Prabhu. My mother was getting treated here. She had a blockage in some heart veins, and Dr. Prabhu had relieved those veins. That I knew, and that was something I think 1 or 2 years before what had happened with me. So I knew at the back of my mind ki Dr. Prabhu, my mother had taken a treatment with Dr. Prabhu.
Your mother says she has fixed the operation and all for heart surgery.
Yes. She had fixed the operation for the blockage removal, and before that we were supposed to do some angiography. So my mother was treated for that, and then when we took my mother to Mumbai for doing the angiography, the blocks were all cleared. She was absolutely safe, and because of that we didn't do any operation of her heart, whatever was the problem. So I knew it was there at the back of my mind ki so and so problem was solved of my mother. So I just took a chance. I went to Dr. Prabhu. I said ki I am so and so, I am son of Sarla Vandare, and I have a problem, and I explained him the whole problem. The ball had hit my testis. The testis is paining. I did so and so medication. Now in the meantime, what happened was, doctors, when they came to know that the pain is not going off, what they advised
it was very
me,
severe pain.
It was a very severe pain, and what they said me ki there is some physical damage inside, and the only way to rectify this is to lock the testis with the flesh there. Or with the bone, whatever. But then the thing was that ki the testis, which usually is hanging, has to be kept locked with the body. That is what they were saying. So with a hook or something like that.
And that was only on trial basis, like.
That was also on a trial basis. Ki this is what something we have to do. We have to open and see what has happened, and then we have to take the decision. But this is what is the ultimate solution. There is nothing more than that. Now, when it came to testes, and doctors are saying you have to lock the testes and all these things, it was too complicated for me to understand all that. And I was very scared, first of all, ki, that operation at that particular place is a very sensitive issue. And somehow I was not ready to go for an operation. So what I did was, ki, I said, let us try something else apart from this operation and all that. So I came to Dr. Prabhu. I explained him all this, whatever I had. And then he said, it was for him also for the first time he was doing it. So he said, okay, I'll just try. So he also said, ki, no, this was the first time, so I cannot give you any sort of guarantee or so, but I can try. I said, doctor, please do something, because I don't want to go in for an operation. If at all something that you would do will be something only beneficial, or it will not go reverse.
Yeah.
That much confidence I had. So I said, no, doctor, you just try for me. And he did it. Now I remember right from the day one, he started pricking needles, and at various positions which were very painful for me. He also did that hand massage, with the
Hand stimulation of needle.
whatever. So I remember it was so painful when he used to do it. I mean, he was also scared in doing it to me the way I was, shouting and screaming. But then ultimately I took the pain because I knew the pain which I used to get is so unbearable. Especially when I was, in the nights and all, when I was going to sleep, when my position was very straight on the bed. At that time, the pain would aggravate, and that pain I knew at the back of my mind that it is unbearable. So I said, let me try this. Whatever is the pain, let me have it. And then, as it is, as what we thought, I started getting the results. I think within 6 days, I started getting the relief of that pain. I took the treatment. I took that painful treatment from the doctor, I would say, for nearly 4 months. And I think from the 5th month onwards, it was all clear. And I took the treatment for 5 months, for 10 sittings in each month. And then the things were clear. Till today, today we are in 2011 end, and it is almost, I would say, around 12-13 years have passed. The pain is gone, and I don't have a pain. Initially, what used to happen is because of that pain, I was not being able to ride a motorcycle. Because in the motorcycle, what you have to do is you have to kick, and that kick is always on the right hand side. And my problem was the testis on the right hand side. Forget about kicking, even if somebody else had kicked and started the motorcycle for me, I couldn't even sit on the motorcycle and ride the motorcycle for even 2 minutes. So much was the pain. But now, it's all gone. Now I am riding only the scooter, but a motorcycle also, and the pain has gone. I can't remember those days, in fact, the way doctor used to prick me, and I used to get so much of pains, but then still I took those pains.
You have taken your case as a research, and it was challenging case.
Yes, challenging case. And because doctor was not ready to give me that much high to take it, because I knew how much relief I was getting from inside. So that was one thing that
important thing is lot of cases we are handling like this as research, and we get success. Okay. And after that also we started recording after many years how you are feeling. Now see, so a lot of people has got in mind that acupuncture can relieve you only temporary relief. This is a very bad image in their mind. So what you want to tell you as your experience now?
You see, as far as my experience is concerned, now testis is one part of the story. At the same time, I also used to get treated for my neck. In my neck also there were severe problems, and during that time, a doctor had said I have a spondylitis problem, and they had asked me to put that, collar. But somehow even I was not ready to do that. You put a collar and then you have to move like this. Somehow I want to be free, and physically I wanted to be very free. So I didn't want to get locked up with that. So I was getting treated for my neck as well. And doctor treated me for that neck as well. Even that treatment I took for 4 months. And today this is also gone. So my practical experience is in both these cases, neck is one part of the story, testis is another part of the story. But my feeling is that if you do acupuncture, your problems would get reduced, or relieved rather, not get reduced, but they would get relieved. And
it is a lifetime.
It is a lifetime
because now 12 years.
At least for me, it has become a lifetime this thing.
We are recording now. We have started recording those patients who come and meet us after years together, 10, 20 years. They come and meet me, and we have started doing their recordings now. Okay. And we have found those records also we got now. The people are totally normal and totally fit and fine, and almost they have forgotten all the stories or what they were suffering. And even your mother, now when she had heart attack and she had to be operated, and open heart surgery was fixed in 1997.
Before that operation, we came here to Dr. Prabhu, asking him that we have within the next month we have an operation of her, and we don't want to do that operation. So you please remove the blocks and you give us a result.
Yeah, that also will do. That also I will do again.
Yeah, and I know
total
you.
recording.
I remember you had told my mother that even that was the beginning for you to treat the heart patients like this, the blockage patients, and you took it as a challenge. We took it as a challenge to, my mother took it as a challenge. And when after 1 month's treatment, when she went to Mumbai, she did the angiography, and they didn't find any blocks in that heart vein. So the operation was ultimately not done. So
until today now 14 years passed.
14 years have passed,
she is totally normal without any medication.
Yes, without any medication, and she is all fine. The heart problem is all solved.
And after that, because my mother was treated first, and then your mother was treated second, and then you have treated around 4 more patients. That is, one is Bakkar and one Jagdish. So like that patients were treated, and they are till today without medication, totally fit. But only we are not getting support from heart doctors or cardiologists. So always taking risk in taking patient, because if we start taking patient for heart problems, and if they come out and before treatment only if they die, so who want the risk? So we are not taking, only because of our patient relation. Those patients we were treated who are related with other patients.
Correct.
How we have taken the cases, and all cases are fit and fine. If cardiologists and other doctors supports us, we can help lot of patients like that from the heart problems also. Okay, so thank you very much for your recording today, because we are presenting your case in China, and because this type of cases there is no answer, and we have done research cases. So just want to present this case. Okay, thank you very much.
Thank you.